My name is Rachel Whitmer. I'm professor of public health sciences and neurology and co-director of the UC Davis Alzheimer's Disease Research Center. Children born today have a 1 in 2 chance of living to age 90. Unfortunately, most of what we know about brain health and brain aging is based on what we call typical elderly people, and we know very little about the brain after age 80 and after age 90. So the goal of the Life After 90 study is to really evaluate what does cognitive aging and risk factors for dementia look like after age 90. What is the role of early life health, both behavioral risk factors and cardiometabolic health, over one's lifespan? How does that affect what brain health looks like after age 90? And finally, another goal of this study is to really understand what we call cognitive superagers. We have people in this study who not only do not have dementia, but they have cognitive performance like someone 30 to 40 years later. So we're really trying to dig in and understand who are these people, what does their aging look like, and what does their life course risk and protective story look like? What were they doing in young adulthood and midlife that really set them up to be a cognitive superager? Life After 90 has enrolled over 1,200 people, all of whom are age 90 and older. What's been really exciting about this work is that we found out that in people who start off in our study at age 90 and they don't have dementia, we found that in a 3 to 5 year period, we do have groups of people that are at high risk of getting cognitive impairment. We see these people every 6 months for our research evaluations. And we have found that women are more likely than men to have cognitive impairment. We have also found that there's a group of people that we call cognitive superagers that have cognitive performance like those 30 to 40 years later. We've also found that risk factors in midlife and early adulthood are very strongly linked with risk of cognitive impairment after age 90. But what's really exciting is we have a group of people in our study who have risk factors for dementia in midlife. They have elevated cardiometabolic risk factors, high BMI, high blood pressure, or high cholesterol, and those are risk factors for dementia. But we have a group of people in our study who have those risk factors, who stayed alive, who are in our study, and still do not have cognitive impairment. So we're really trying to understand who are these people who have what we call resilience, who have risk factors for poor brain health outcomes, but are not getting a poor brain health outcome. So it's a really wonderful opportunity to understand what happens over the lifetime. We know more about outer space than we know about the brain after age 90. So this study's been amazing. It's been going on for 8 years. But if it were to stop, we would lose our chance to uncover what the clues are for risk and resilience to optimal brain aging outcomes in very late life.